Hello everyone. So this is a demonstration of PractiPal. PractiPal is your AI-powered virtual standard patient. So this is basically for the use of medical students and nursing students. They can hone their clinical history taking through realistic conversations because the patients are simulating various diagnoses. So let's get started here. So I'm already logged in. So we have 5 sample patients here: a patient of dengue fever, a patient of megaloblastic anemia, a patient of viral pneumonia, type 2 diabetes without obesity, and type 2 diabetes with obesity. We are going to start with the patient of dengue fever. When we click start, this kind of interface opens up, and here we can start or end the conversation from here. We can mute the conversation with the patient here, and the transcript of the patient will be constantly appearing here. We will be talking in audio format with the patient. So let's start.
Good afternoon, doctor. I am Rohan Kumar. I am 24 years old. I am here to seek your help today.
Hi Rohan, good afternoon to you. I am Dr. Bhatia, and please tell me, how can I help you?
Doctor, I have had a high fever for the last 5 days, and yesterday I saw some red spots on my skin.
Okay. How high was the fever?
Doctor, the fever was very high, around 39.5 degrees. It was mostly in the evening and sometimes with chills.
Oh, you had chills also. Did you have anything else?
Doctor, I have headache, pain behind my eyes, muscle and joint pains. I also feel a bit nausea, but no vomiting or bleeding.
Okay, understood. So you also mentioned rash. I wanted to know, when did the rash first appear?
Doctor, Doctor, the rash appeared on the fourth day after the fever started. It is red spots mainly on my arms and chest.
Have you checked your soles of your feet? Are there any rashes on the soles?
Doc, Doctor, I did not check the soles carefully, but I did not see any rashes there.
Okay, understood. I will check them during the physical examination. Did you have
Yes,
any
doctor.
did you have any diarrhea or vomiting?
Doctor, I did not have any vomiting or diarrhea.
Or any kind of bleeding like from nose or the gums?
Doctor, Doctor, no, I have not had any bleeding from nose or gums.
Okay, understood. So this is beginning to look like a viral fever to me, but it can also be dengue or malaria if you have had exposure to mosquitoes. So have you had any exposure to mosquitoes?
Yes, doctor. I recently traveled to a village near Delhi where there were stagnant water pools. I think I got bitten by mosquitoes there.
And you were not taking any precautions like repellents or mosquito nets?
Doctor, I used some mosquito repellent sometimes, but not always. No mosquito net.
Okay, understood. Do you have any other chronic medical condition like diabetes or high blood pressure or anything?
Doctor, I do not have any other medical problems. No diabetes or high blood pressure.
Any medicines that you have taken till now?
Doctor, Doctor, I only took paracetamol 500 milligrams when I had fever. That is all.
Okay, understood. May I know what's your occupation? Do you usually work outdoors or do you travel frequently?
Doctor, I am a software engineer. I mostly work indoors, but I traveled to the village recently.
Okay. So I'm going to now do some physical examination and see your soles of your feet.
Doctor, yes, please go ahead.
Okay, I can see that there are no rashes on your soles. I'm also examining your abdomen to see your liver and your spleen, and they also appear to be normal to me. So I'm thinking of ordering a lab test for checking if there is malaria or dengue. Are you okay with that?
Yes, doctor, I am okay with the tests. I just want to get better soon.
No problem. I will order these tests and please come back to me for review along with this test. Is there anything else that I can help you with?
No, doctor, that's all. Thank you.
Thank you very much. Have a nice day.
Thank you, doctor. Namaste.
So I have ended the consultation here, and now what you are going to see is there's going to be a summary generated by artificial intelligence, which is going to give objective as well as subjective feedback for the student to improve. So here is the consultation feedback. For communication skills, out of 20 points, the patient has scored a total of, sorry, the medical student has scored a total of 16. This is also described like the doctor has introduced himself, asked how could they help. So there was a 4 out of 4 score. Where the doctor has scored less is active listening and empathy. So the doctor acknowledged the symptoms. They did not explicitly show empathy, saying like, I understand this must be difficult or something like that. So a little less score there, but overall he has scored 16 out of 20. For history taking, chief complaints, he has asked everything, 5 out of 5. Fever pattern is got 4 out of 5 because the doctor did not explicitly ask about the onset duration pattern. For rash, he's got all 5 associated symptoms, and epidemiology, he's got 5 out of 5. So history taking score is 24 out of 25. Physical examination, vital signs were not examined or asked about except for the fever, which the patient mentioned himself. So the score is 0. For skin, the doctor said that I can see there are no rashes on the sole. So it is 3 out of 5. Lymph nodes and bleeding was not mentioned. So again, it is 0. Physical examination, therefore, has been only 3 out of 20. For clinical reasoning, the score is 9 out of 20. As there can be a primary diagnosis, a differential, and investigations to be done. And the knowledge on dengue has taken a score of 11 out of 15, as the doctor mentioned, various things. Overall score is communication skills 16 out of 20, history taking 24 out of 25. Now, here is the analysis of the consultation. Key insights are presenting complaints, associated symptoms. So this is all generated by the AI. And this is the feedback on question relevance. So for example, questions about fever, associated symptoms were highly relevant. And if they're irrelevant, they will be pointed out by the AI. Now here is the area of consideration that while asking about rash location, asking about the type of rash could add more detail, though this might require visual assessment anyway. So this is the feedback. Feedback on diagnostic accuracy will be there, and the weaker areas, there will be area for consideration, like doctor's initial statement. So this is beginning to look like a viral fever to me is a reasonable point, but quickly pivoting to dengue malaria based on exposure is important, which doctor did. So it's a good thing. Considering other potential causes of fever and rash should also have been mentioned. Overall areas of improvement for the doctor have been mentioned out here, and this is the total list of consultation. So overall, this is how this helps the medical student learn better. So I think this is all as far as this particular demo is concerned. Thank you.